vacation time for the cow. Okay? Darling, you finish milking, go and eat some food, get ready to give birth. Right? Put on some size, calm down, chill. Right? That's what that is. Vacation. Cow vacation. Okay? Now the problem with that is that our gestation period is 283 days. Right? So roughly 9 months. Just like women. Right? So for us to achieve a calf per cow per year, that means we have to get her pregnant by about 90 days. Okay? She's just had this massive, stressful situation where she's given birth, thank you, right? Where she's just given birth and she's all dirty and she might have mastitis and all sorts of things happen in this thing. This is when vets make their money. This period here.
Yes.
Yeah? This is when we make all our money. Yeah? So we actually asking this cow to get pregnant at her most stressful time. Yeah? So we want her to get pregnant here, right? She's a biological being, so just like women, it doesn't happen like magic. Okay? Conception rates are probably about 40% in temperate countries. I'm not sure what conception rates are like here. I know in Trinidad we probably about 25-30%, if we lucky. Right? That means that if you're 25%, that means 1 in every 4 inseminations you get a positive conception. Right? That's not really good odds. Okay? Dr. Ganesh would know Dr. Board. And, yeah, right? He was the theologian before me, and he didn't hold his tongue. And he said, if we wanted our women to be as fertile as our cows, we'd be in problems. Yeah? Because 1 in 4 is actually plenty. Yeah? So you have peak, which is a huge energy release. How much milk you get in per cow?
Yeah.
Yeah.
Average got
12. Okay, so 12. So 12 by 305 days. Okay, you get about 600 liters for lactation. Right? 600-700 liters for lactation. So the area under the curve is 600-700 liters. Okay? So your peak might go up to 14, 15 and then come down, right? What we want to do is so the first 45 days is the voluntary waiting period, right? 45 days. You don't want to serve anybody in that time. Can she get pregnant in that time? Yes, she can, right? But you don't want to do. You want to say, you just had a calf, calm down, relax, clean out, right? Because she has to pass all this gunk and everything out. Her uterus has to come back down to size. All the inside lining of the uterus has to come back and she has to start cycling it. So we give her 45 days. Yeah? Typically, if we have a problem with the cow, she had mastitis, so she had milk fever, she had a dystocia and had to have a C-section or something like that, we double it to 90 days. Okay? So we give her a longer time to recover. Okay? I've known cows that have given birth 10.5 months apart. Yeah? So, but that's not ideal. Even if you can do it, it's not ideal. Okay? So as I said, it's a voluntary waiting period, so 45 days. So what you want to do is institute a program where you do what's called a postpartum check. At 25 to 50 days. Okay? Every cow should get a postpartum check at 25 to 30 days. And a postpartum check, usually we do a vaginal check. So we go in, we make sure there are no rips in the side of the vagina. We make sure it's nice and clean. So I basically go in with a clean glove, right? With a little bit of lube on my hand, not a lot of lube, right? A little bit of lube on my hand and just take me 10 seconds. Flat hand, make sure everything is fine, cervix is nice and close, and I come out and what you call a vaginal scoop. So I come out, and usually when I open my fingers, it looks like the same lubricant, lubricant gel and whatnot, the clear gel. It looks like that. You have a whiff, right? And if it smells all right, you then, okay, so inside the vagina is fine. I now can take the same hand, put on a little ball glue, and go in rectally, right? And then I go in rectally. I make sure the uterus is starting to involute, okay, meaning that it's starting to come back, shrinking. And anybody who has done a C-section of a cow, you know that when you actually start stitching, it's already, you can actually see it and closing down, okay? So it closes really, really quite quickly, okay? But you want to make sure that that has happened and it's come down back to normal side. And most importantly, you want to make sure she's cycling. So whether she has a follicle or CL on the ovary, it doesn't, I don't really care which one. Once I know she is cycling, it doesn't matter to me which structure I feel, okay? And then that's, when I do that, I've made a diagnosis and my plan for that animal. The students always ask me, well, you have to have a plan, you have to tell the farmer. My plan is, okay, yeah, she's good. She's good to go. Right? She can now start breathing. Alright?
No.
Yeah?
How do you know that at that point the animal is cycling? Is it,
You can feel the ovaries and feel the follicle or the serum.
You don't need to do ultrasound. That's pretty.
No, I can park it as practice. Right, so remember ultrasound is a step up. If I don't have ultrasound, I still could do everything. Right? Obviously ultrasound is better because you can see things. And now that we have ultrasound, you start realizing how many mistakes you were making before. Right? And confusing a CL with a follicle or a follicle with a CL or something like that. Right? Because sometimes they can't feel quite similar. Which is why I don't jump down a student's throat if they get it wrong. Because I get it wrong too. Yeah? So if they're at 45 days, we start service and they have a, say, 40% conception rate, that means that 40% of the animals will conceive. That means 60% didn't conceive. Okay? So then, hopefully they come back in and get 20, 21 days later, so about 66. Some of them will conceive, some of them will not. Then we have another shot, about 85, 90 days, some of them will. So hopefully by 90 days, the bulk of them have conceived. Okay? And if we get conception here, that means these cows are pregnant from about 90 days up to 365. And they will give birth at this point. Right? What we do not want is we do not want cows that are both dry and open, not pregnant. Those are wasting cows. They're just eating people's food and they're not doing anything for you. So you don't want those. Which means, and you can't pick it up here and have a problem. Your problem is quite back here, it's 9 months before. So that's why it's so important to pick up pregnancy, diagnose problems on the ovaries, diagnose problems, endometritis and whatnot, early. Because you're not going to notice you're losing money until 9 months later. Yeah? So that's one of the things why we have the ultrasound. We pick up that pregnancy as early as possible and know, yes, she's pregnant, off she goes. Or we can pick up, if she's not pregnant, but what are we going to do about it? That's probably more the issue. She's not pregnant, so she's not conceiving, or she's not coming into heat. We can't just let her go along her merry way and naturally thing. Right? We want to do something. Right? So that's where we come. Yeah, I think that's for what we're looking to do. I think pretty much that's it. In terms of management of fertility issues, we have problems with cysts. So a cyst is essentially a follicle that didn't ovulate. Okay? We still don't know how to deal with cysts. Millions of dollars of research have gone into cysts and we still have no clue what to do. Right? Everybody trying this and trying that, and some of it works and some of it doesn't work and whatnot. Right? We do know that the use of cedars has a better outcome than just giving GnRH, and it seems to be because putting in Absida and then yanking it out is equivalent to giving an injection of generation. But what the added value it has is that you also prime the system with progesterone. Okay? So although it's a little bit more expensive, you have a bit better outcome.